Okay, here I am doing observations, and here comes Dr. Ellis. Let's see if she does it. Great job, Dr. Ellis.
Hi, my name is Dr. Ellis, and I came to check your dressing for this time.
Let's see if she does
Alright,
it
I
coming
will
out.
send Nurse Gibson in here to finish the rest.
Great job, Dr. Ellis.
I'm sorry, I forgot to check one more thing. Can I check one more time? Thank you. Alright, Nurse Gibson will be in here soon.
Hi, Dr. Ellis.
Hi, Dr. Johnson.
How are you?
I'm good.
I just want to take a moment. I saw you coming and you performing hand hygiene the way we were supposed to. Thank you so much for doing that. That's an important piece in keeping our patients safe. But I also noticed you went back in and did another examination, but you didn't do hand hygiene going in or out on that one.
Oh, I'm so sorry. It just slipped my mind. I had a train of thought and I really needed to complete it.
I know we have so much going on that is one of the things that actually happens more often than not. And I'm really working on something that will help us with a reminder of some sort. So there's actually this new product that's out there called Clean Hands, Safe Hands. And one of the things I want to do, kind of like a prototype deal, was see if that might be helpful for us. And it's just a gentle reminder. It's through information technology that actually will be a sensor on the hand sanitizers, and then employees will have a badge reel that will speak to the sensor to remind them to do hand hygiene. Do you think something like that may help?
I think that sounds like a great idea, especially if we are busy throughout the day. Would I have to go to each station, or will it be a designated area?
It's a great question. One of the things is that the badge will actually sense when there's opportunities for a provider to have hand hygiene done. So it registers to the sensors when you're in that close proximity of going into a patient's room. But you bring up a good question. Like I will have to go back and ask that question to the company because it's an existing company. But I need to ask that question because I would hate for you to keep getting registered as you pass all the hand hygiene stations, right?
Yes, yes. I feel like at that point it would take up time and it would be just.
You'd become complacent all over again because it's just that constant reminder.
Yes.
Now, here's the nice thing about it is when you have a missed opportunity, there's actually a voice reminder that will say, please remember to do hand hygiene, which is just a nice little trigger that will remind you to go, oh, you know what? I need to perform hand hygiene.
That's nice. What about for our hearing impaired teammates?
I didn't think about that because Dr. Martin would absolutely not hear that. I don't know, do you have any ideas that maybe I could take back?
Well, whenever I silence my phone or my watch, I have it on vibrate and it's a tactile sensor, so
Oh, wow.
I think that would help.
Oh, I didn't think about that. So maybe like a tactile motion in the badge?
Like a vibration?
Okay. Well, I'll definitely go back and ask the company about that as well. I'm trying really hard. Our CLACSI rates have gone up significantly over the last year. And I just know hand hygiene, as well as you know, is just one of those important steps in helping with the hospital-acquired infections. So just trying to do my part anyway, anyhow, and just trying to see if that product would actually help us.
Would this be an expensive cost for the hospital?
No, I'm actually looking at what they're offering. Is that the sensors can attach to any hand sanitizer or soap dispensers. So really it would just be bringing the sensors and connecting them to our existing stations and getting teammates new badge reels.
Wow, that sounds very convenient. Well, I think you have a great idea and I'm excited to see what it's going to bring.
Okay, well, thank you. Thank you so much for your time. And thank you for the questions. I definitely will take that back and see if the company has answers for us before we invest in this.
Thank you for bringing it to my attention.
Thank you. Have a good day.
You too.